Hi, welcome to Harmonizing Your Horse's Health. I'm Dr. Amy.
And I'm Dr. O. And today, I'm going to play the devil's advocate. Dr. Amy, I hear you tell people all the time, go get your horse adjusted, get your horse adjusted, get your horse adjusted, and that'd take care of the problem. So today, I'm going to ask you specifically how chiropractic care is going to help some of these problems that I've heard you say, and they're not musculoskeletal problems. Is that okay?
Sure. I tell people that all the time.
All right. My horse has an ear shaking problem. He shakes his head and messes with his ears all the time.
You know, I don't see horses shake their head or mess with their ears, but I do see them not want anybody to mess with their ears very often. And I'll tell you that, clients will look at me and say, well, how are you going to fix that? And I am standing right there holding the horse saying, I just did, because we've already adjusted him. What they don't oftentimes realize, Dr. O, is that the nervous system is sensory input from the environment in through our skin, and in particular, in terms of the ears, in the muscles that are surrounding those ears. So we're looking at facial nerve muscles, we're looking at all of the branches of that surround that ear and can sometimes be not working right if the head isn't on straight. So if you put your horse's head back on straight with a little chiropractic adjustment, which isn't always easy, especially if their ears are very sensitive or if their poll is very sensitive, then they will stop being so upset about you touching their ears. Occasionally, we even actually adjust the ear.
Okay, all right. I'll give you that one. What about, I have a horse that has sinus problems. Now that's like inside the head, inside the bones.
Well, sure. But you have to remember what is inside that head that's causing the sinus problem, and what's in there is pus. And I'm a veterinarian. I love pus. But you have to remember where pus comes from. Oftentimes, if there's not a tooth involved in causing that sinus infection, we have to go back to remember where blood flow lies in the head. And more often than not, as blood flow circulates through the head, it can actually become impeded when we have muscles that surround the back of the head that are too tight or spasming, when we have joints that aren't moving right because of those muscles. They can actually change the blood flow through the blood vessels that circulate through that area. And when we change that blood flow, we impede venous return. All right, most people forget that arteries go away from the heart. Venous return or veins go back to the heart, but they don't have the muscle in them that the artery does. So blood pressure through them is a little bit different. When blood pools in those vessels, it begins to leak through the sides of the vein. The sinuses are a great place for that leaking blood to pool up, leak through the outside, leave the serum to become that sinus infection or pus in the head. So if we adjust that head and neck and atlas, then we relieve the muscle spasm, we allow for normal blood flow and sinus drainage.
Okay. All right. I've got a horse with a cough. That's not pus.
Is it a dry cough or a wet cough?
Dry cough.
A dry cough. See a lot of those, especially when they're not coughing most of the time, but you tack them up, you get them going around the ring, and the first time around the ring, you get one good cough, and everybody says, oh, it must be the dust in the ring. And I always say, yeah, the dust might be a little irritating, but if the dust is that irritating, he should be coughing the whole time. More often than not, these are horses who have problems with a couple different areas. And it can be the larynx. The larynx is the area where they decide whether they're going to breathe or swallow. And if there's been irritation in the pole, if we've got muscle spasm in the head, again, this is a horse who needs his head put on straight so that all those muscles can work correctly, then that muscle spasm that makes it difficult for him to breathe when under tack or being asked to collect needs to be fixed so that he can breathe without having to cough, to rearrange his larynx and pharynx and get it in the right order. The other area that horses who cough oftentimes have trouble is in the lower neck. As that trachea enters the chest, sometimes there can be subluxations or muscle spasms in the lower neck that put tension on the trachea that will emit a cough. So when they start moving forward, trying to lift themselves up, if there's a subluxation there, particularly if they have a rib that's out of alignment, then they're going to cough a couple times because they are a little bit sore. So if we put those back in place, we're doing great. The third place also comes in the lower neck, C3, 4, 5, sometimes 6, where the phrenic nerve exits the spine. And that phrenic nerve is responsible for normal movement of the diaphragm, that big fan-shaped muscle that protects the chest from the GI tract. If that phrenic nerve isn't working quite right, and there's a little bit of change in the way that diaphragm works, we may elicit a cough as well.
Okay, so I'll give you that one. Allergies. My horse has allergies, Doc.
Sometimes that's a multifold problem, but in terms of chiropractic care, because there are other items coming into play here, we have to remember that's our friend histamine. It's our immune system that's not working. If the immune system isn't working, if it's overtaxed, if it's responding too quickly, that's usually because we have gotten into the inflammation cascade. We have gotten into the activation or overuse of that emergency response to stress, to environment, to damage, to poor nutrition that has got us into a loop that causes an over-response to some of the things that can trigger an immune response inappropriately. Most allergies are actually autoimmune dysfunction. How do we fix that chiropractically? We keep that nervous system working at its top rate. We keep those spinal segments open and fluctuating so that the nerve system can do its job.
All right. I see where we're going here. What about, my horse has a little bit of problem. My vet has said that he may have some heart problems. I know that that's an age problem, but do you still think he needs a chiropractic adjustment?
Age is not a disease. Ever. Age? Heck no. More often than not, those horses that have heart dysfunction who did not come with it, in other words, were not born with those problems and have developed it over time, have developed it because they're having trouble with their vagal nerve, which is the nerve that exits at the base of the skull, travels down the side of the spine, and it helps regulate tone and muscle function of the heart. The other thing that's really cool about the heart is that once it's stimulated, the actual muscle fibers in the heart have nerve type tissue in them. So they stimulate one another as well. So guess what? If we don't have normal initial signaling to that heart, then those individual muscle fibers within the heart can get off and not function to their best efficiency. So chiropractic, keeping that vagal tone normal, can actually keep you from getting heart disease, but it can help alleviate that heart disorder as well.